Okay, so we're very fortunate to have a lot of great folks from OHSU working with Build EXITO, and they're going to be on the panel today talking about diversity. And I'd like to introduce Dr. Cindy Morris, who is on the EXITO executive leadership team, and she's going to be introducing her folks from OHSU.
So, greetings everybody. I'm Cindy Morris. I'm the OHSU face of EXITO. And today I've been really pleased to put together to introduce Sunil Joshi. So Sunil is helped put this whole panel together for us. Sunil is an MD PhD student at OHSU and finished his 2 years of the MD, or year and a half of the MD, and is in your second year of the PhD? All right. So he has helped bring together a nice group of individuals today who represent different departments, different perspectives on what it's like to be a PhD student, a health science student, a variety of different things. So welcome, and I'm going to turn it over to him.
Well, good afternoon, everyone. Happy Friday. Thank you for coming. Again, my name is Sunil. I'm a MD PhD student at OHSU. So I'm in my third year of the program. So that means I finished my first 2 years of medical school, and I'm finishing up my first year of my PhD. I was born and raised in California, so I'm not from Oregon, but I've had a great time being here. Thank you for bringing the sun with you. I want to introduce all of our various panelists and have them mention where they're from and what program they're representing today.
I'm Minju. I'm a PA student or physician assistant student from OHSU, and I'm from Hawaii.
Half a day, everyone. My name is Suzanne Bernardo. I am also a physician assistant student from OHSU. We are in our second year, and I am originally from the beautiful island of Guam.
You got some love there. Hello, everyone. My name is Esteban Garza. I am from Yakima, Washington. I am in the MD program, and I am just starting my third year.
Hi, I'm Allyson. I am from Portland, Oregon, born and raised, and I am also starting my third year of my MD program.
I'm Kalisha Bonds. I am from Tennessee. I am in the third year of my PhD in the School of Nursing. I am also a nurse practitioner. I guess that's it.
Hi, I'm Kiki Fornero, and I'm originally from California, and I also lived in Oklahoma, and I'm in my third year of PhD training at OHSU as well in nursing.
Hi, my name is Wafaa Binali. I'm from Saudi Arabia. Yes, the country lost to Russia 0-5 in the World Cup. I'm in the PhD program. This is my 6th year, and hopefully I can finish in December.
Hi, I'm Hsin-Yun. I'm originally from Taiwan, and I'm currently a second-year grad student in cancer biology program. I'm a PhD student.
Well, thank you and welcome to all of our panelists. Now we're going to open the floor up to any questions. It's going to be very casual, so we have an hour of questions that you have, and then at the very end, our panelists have agreed to stay on for a couple more minutes to answer any one-on-one questions. So now I'm going to fire it away to all of you. Any questions that you want to any questions that you want to start off with? Thank you.
As a person of color, what would you say is one of your most difficult or like your most challenging things you've had to like face in your journey?
Living in Oregon. And I say that because Tennessee is about 18% African American, and I lived in Atlanta, which was 54% African American, and I forgot I was black there. And then from Atlanta, I moved here, and I am reminded every day that I'm black. So that's been a challenge because it can be isolating, and sometimes you feel like you don't deserve a seat at the table, but I will tell you that you do. And your voice and your perspective and your experiences add to the richness of classes and will make a difference in whatever program you decide to go into.
Even not necessarily in college, but even in grad school, it can be challenging too for minority students. because you often have to deal with people questioning whether you belong there. I've had people like hunt me down and say, "Who are you? What are you doing here?" Even though I have my white coat on. People walk past me because they don't believe that, oh, she's actually in a medical program. So I would definitely say that despite these things, I still enjoy my program, and it's just something that you have to learn to deal with, unfortunately, especially like she said, being in Portland where it's not a very diverse place. But what's great about OHSU is we have a really great minority student body who comes together, and we're there for each other when these moments happen.
I'm actually first-generation American, so something that has made obtaining higher education really hard for me is not having a family who understood it, even though they were very encouraging of pursuing higher education. And they're very supportive, and they always wanted me to go on, but understanding things, simple things like what a credit hour is, and how many do you need to take, and how do you address professors, and how do you get through college? And I think the main way to deal with that is to kind of find people that you can settle with and that are willing to show you the way. So find really good mentors. And just be persistent. If there's a will, there's a way. And I truly believe that. You have to have that mindset to sort of keep enduring.
Just a little bit to piggyback off of finding a mentor. Definitely, being a person of color is difficult in any field, but I think you are definitely underrepresented in some of these fields that we're talking about today. So something I want to encourage you to do is find mentors, but also I think something that's really important to know is the importance of actually networking. And I want to impress that a little bit on you guys today. So I think people of color, minorities, underrepresented individuals, this notion, this idea of networking isn't really taught, at least in my experience. And I think it can be really important for you down the line. You never know what doors are going to be able to become open because of somebody you know. I think a lot of us want to believe that it's your merit that gets you in the door. And while I think that's great and that's awesome, I think a lot of times it's who you know. And so that can be important. And by networking, I mean, getting your feet wet a little bit early. You guys are an undergrad, you guys are here, you're doing the right thing. And I think, volunteering in labs, going to talks, introducing yourself to different PIs, just getting to expand your network. Because you never know down the line who's going to be able to open a door for you.
When it comes to problems I might have encountered being a person of color, especially in the healthcare setting, I have encountered some instances, especially in more rural populations when I was down in Klamath Falls, where they would ask what my ethnicity was, or ask me where I originated from, or they would make some unnecessary comment about mail order brides from the Philippines, or things like that. And I've learned, luckily it hasn't been the case where it's been too often. It's pretty much that one isolated time. And I actually think when they ask me where I'm from, I use it as an opportunity to educate them about this really great place that I come from and this really wonderful upbringing that I had growing on an island, never being more than 15 minutes from the beach and having this huge family-oriented environment that kind of shaped the way that I treat my patients and the way that I look at healthcare. So I also, even though you may in the future at some point get these kinds of remarks, I think finding a way to deflect it in a positive way and kind of rephrase it so that it's a conversation where you educate them and you let them know, this is who I am, this is where I come from, and I have something unique to bring to the table.
Other questions?
Yeah. How expensive is either MD or PhD programs, and how are y'all currently paying for that?
Man, what an excellent question. So I think it's going to be a little different for Allyson and I. We're both third years. However, I'm out of state. And so you are in state, if I'm correct? Okay. So I have to pay $90,000 a year. And $90,000. Yeah, gross. There we go. So it's a little more difficult. I am paying well, luckily I'm married, so I have a wife who's supporting me financially. Clearly she doesn't make 90,000, so she helps a little bit, but I'm very much relying on loans. It's the only way I can do it.
So I'm actually in a unique position where I actually got a scholarship to go to school. So that helps a lot. I think in-state tuition, though, if you didn't have a scholarship, is $40,000 a year, not including housing.
And the School of Nursing is a little different. I just know it's $771 a credit hour. That's how I keep up with it. I don't look at the larger number for out-of-state tuition because I moved here for school, and so it doesn't matter that I've been a resident here for at least 2 years because I moved for school. I'm considered out-of-state. Horrible rule. But the School of Nursing gives the first 2 years was fully paid. So if you graduate, which is a little different for the, so let me clarify. The PhD has scholarships for the first 2 years. The first 2 years we take courses, and then however long it takes you to do your research can be from 3 to 7 years. I don't know about undergrad or master's. Personally, for my undergrad, I was given federal Pell Grants because I am a first-generation college student. I came from a very low socioeconomic status. My grandmother on disability raised me, and so she knows very little about education. She did receive a high school education, but so undergrad was paid for through governmental assistance. I don't know if anyone has a different story.
For PhD program, the tuition is waived, and we have a stipend yearly, like 33,000. But that's not the reason you choose to be a PhD student. You have to be passionate about research, so you don't have to worry about the you have to pay the tuition, but just can focus on research. It's not high, it's not just enough to pay the rent and do daily things, but. Yeah. Or all the other PhDs similar at OHSU.
Sometimes it's painful to sign up for student loans, but I do want to put a plug in for some programs. Once you graduate, it depends on what your career path is, and after a certain amount of time, they'll actually pay it off for you. They'll be forgiven. So especially public service types of careers. So don't be shy. I mean, be conservative about borrowing, but also don't be shy about investing in your education because there's more than one pathway to get it paid off.
So speaking on behalf of OHSU PA program, I don't exactly recall how much it is. I think $45,000-ish a year. So it's a 26-month long program. One great thing is, first of all, this is an investment for your future. So I think education is worth every penny. And second of all, second year for us doing clinical rotations, and then I think it's pretty similar for MD students that we get housing for off-site. So for example, rural areas like Coos Bay, Klamath Fall, we get housing provided if it's not within the metropolitan Portland area. So that's been really great. Things are sort of organized in that way that we don't have to be searching for housing every 4 weeks. So that's also unloading a lot of burden on the financial aspect.
And I'll speak on behalf of the MD PhD program. So that the MD PhD program at OHSU is fully covered. So that pays for all 4 years of medical school and for your 3 to 4 year long PhD. And most MD PhDs in general, most MD PhD programs across the nation are paid for. However, there are certain ones that don't cover the PhD cost. So moving on to the next question.
So between graduating from undergraduate and now, What is your proudest moment?
My proudest moment in medical school so far was passing step 1, which is the first part of our licensing exam. I studied for 9 weeks, 10 weeks maybe, and so that's all I did for 10 weeks. So it felt amazing to be done with the exam.
I'm still thinking. Only one, like our proudest. That was a yes? Well, I went to school a couple times. So in nursing, it's a little different because we get a bachelor's degree. So I was really proud when I became an RN, and then I became a psych nurse practitioner. When I went back and got my master's, I was really proud then. And now in my PhD program, I will say having my first publication out in print was exciting. My proudest moment. My grandmother didn't know what it was. She's like, "Is that good or bad?" Like, it's good, so she was glad for me. But yeah, so thank you.
I guess I'll keep the mic. I have proud moments, since someone mentioned. I actually feel like I have a proud moment almost every day at work, because now that I have my master's in nursing education, I teach nursing. And so I really enjoy that role, kind of tied to my first answer, because every single day I'm mentoring people. And the reason I kind of fit into that role is because I realized how important it is to have someone willing to guide you. So that makes my heart happy every single day I go to work.
After I finished my bachelor degree back in Saudi Arabia, I started working as an ICU nurse, and I was the first Saudi nurse in Saudi Arabia in the ICU in that hospital. So that was really amazing. Saudi Arabia and other Gulf country depends on expatriates, nurses, and we have not many national that choose the nursing as a career. So that was really my proudest moment. And then I think I worked for 4 years, and the hospital I worked at, they started giving scholarship to nurses, and I was one of the lucky one to get a full scholarship to do my master's degree. I did my master's degree in George Mason University, and then I went back again, get promoted, another happy. And then there was a royal decree to start one of the school of nursing in Jeddah, where I come from, the city I come from. And I was also chosen to join the faculty, to be one of the faculty. I worked, I think, for 2.5 years, and they said, if you go for your PhD, full scholarship. So it was really great. I got a very lucky so far, to have all these scholarships, all these financial burden being lifted and covered completely, and be recognized by my organization, to give me this great opportunity.
Like everyone said, there's a lot of proud moments, and I think it's good to always stop and appreciate the little milestones that you do accomplish just day to day, just getting through the day. But I think when I first started the PA route, I really didn't have a mentor back home on Guam to really tell me, what the process was to apply and prerequisites and how to be a competitive applicant and how to get patient care hours so that I could, apply to these top programs that required more than 2,000 hours or almost 2 years of patient care experience. So it felt like I was really trying to figure things out on my own. There was no pre-PA program. There's not really much of a pre-MD program either established at our university. So it felt like I was figuring things out on my own. And when I finally got into OHSU, I was so proud and so happy to be there. And it was kind of mind-boggling that there were people from back home on my island who found me on Instagram or heard about me from one of their friends. And they were interested in the PA profession as well. So they reached out to me through social media and started to ask me, how did how did you get into this position? Like, what can I do to be where you are today? And so I think that was kind of a proud moment for me, for them to find me and feel like they have a resource that they can turn to. So it made me really happy to give back to the place where I came from.
So I think for the proudest moment so far, I think it's when I attend the conference, and then you finally see like people who show up on the textbook, and then you're like meeting with them, and then you feel like you're part of the community, like part of the scientists, and it's really exciting. And then some people even from the like biography, like scientist biography you read. So I think that's the proudest moment, and I think the proudest moment will be my defense, like during my defense thesis. So yeah, excited.
We'll move on to the next question.
There's often like lessons on how to work with minorities and how to deal with certain groups. Is there anything you've disagreed about when you've learned about how to deal with minorities, and how did you deal with that? Did you bring it up in class, or do you just work differently with people in your practice?
So I just want to clarify quickly. So are you talking about maybe certain trainings that we may have in terms of cultural competency and how we work with that? Is that am I getting that correctly? Okay. Yeah, so I can talk a little bit about that. At OHSU, and in the MD program that Allyson and I were in, we are required to take a class in cultural competency. And it's totally student-led. The students from the year above us go ahead and run that and teach it. And so that gives us a great opportunity to go ahead and talk about some of these difficult issues of race, sexual orientation, religion, all these different things that make us great, that make us diverse. And so we do have the opportunity to discuss that and learn from that. In practice, I can tell you from experience that unfortunately I have had preceptors or attendees or doctors definitely make some derogatory comments about me because of my race, because of where my family was from. And so I think in terms of how I would deal with that, it took me a while to kind of process what the right thing to do was there, right? There's a person who has more power than I do, who can maybe affect my career down the line. But I think for me, it came to the realization that I needed to do the right thing. I needed to speak up so that wouldn't happen again. And so I did talk to this individual about the remarks he made. Now again, when I say that, I want to make sure that I did it in a loving way. I didn't just call him out in front of everybody, you racist, nothing like that. Pulled him into his office and said, hey, you made a few remarks that I don't think were appropriate. I just wanted to talk to you about that. So I think having that class of cultural competency definitely prepared me to kind of deal with some of the racism that, and not just racism, but other things that you might deal with in practice. Does that kind of answer your question, I hope?
So given that I did a lot of my clinical work outside of Oregon, that wasn't necessarily a problem. I will say Kiki and I are in the same cohort, and so when we do a lot of PhD work, one of the things that you learn about is kind of your own biases and your worldview and philosophies and kind of how you see the world. So on a different take, usually people are more open to wanting to know what your experiences are, how you see the world, how you view things. And so that's been my experience here. For the most part, at least from the academic standpoint, it's been more of wanting to know how to make things better. How can we be more inclusive or more open? Which has been really welcoming and refreshing.
So in addition to the structural competency curriculum that Esteban spoke about, we also have an unconscious bias training initiative at OHSU where all faculty members and students are required to take this course, or this one-day training to learn how to be better advocates and be able to accept and respect individuals from all walks of life. So that's definitely a major initiative at OHSU. We also have an a diversity advisory committee that meets with our senior associate dean. mainly the students from the first 2 years of medical school and from other programs also, to discuss how we can continue to foster diversity and inclusiveness at OHSU. Any other questions?
Okay, so for those of you in PA and MD, those two fields can often be kind of, there's kind of a decision between the two, right? There's some similarities. So if you could speak to if you considered the other and what made you choose your field.
Well, I personally only thought about medical school to become an MD just because I didn't really know what a physician assistant was. I feel like a lot of people don't in general population, so I didn't get that education when I was in undergrad to learn about it, but I don't know if you guys decided between the two.
So I definitely was part of that team that kind of oscillated between pursuing MD or PA. And I consider myself really lucky in the sense that I was introduced to the PA profession in my junior year of undergrad. And it was a surgical PA who was originally from Guam and was establishing a new position at our hospital. And I had never heard about the position before then. And this was at a time when I was still in the pre-med route. But I also was a little bit overwhelmed with the amount of schooling and student debt that I was going to be taking on if I pursued the MD route. And I learned about the PA profession and I thought how wonderfully it ticked all the boxes that I wanted to do in my life. I wanted to work in medicine. I wanted to take care of patients. I wanted that diversity of being able to switch specialties because as PAs, we have a lot of laterality in what kinds of specialties we do. We're trained in the general medical model of medicine. But we are also, after we graduate, we have the opportunity to work in a multitude of different specialties. So you have PAs who work in pediatrics, you have PAs who work in family medicine, you have PAs who work in orthopedics or in surgery. And I, as a person who, through my rotations, I found that I have a tendency to fall in love with a little bit of everything. I found it was a really good fit for me. And I also love the fact that I would be able to, have a good paying salary, of course, but also being able to do satisfying work and being able to graduate before my 30s and be able to invest my time and my interest in other passions that are really, the things that I really enjoy doing, like traveling and eating at the places where I travel to, and seeing family and starting a family. So those are the things that I considered in terms of work-life balance and being able to do the things that I love.
So I had a similar story to Allyson. Unfortunately, when I was an undergrad, I didn't know what the PA program was. I think looking back, it definitely would have been something I considered for sure. Definitely, as has been said, there's pros and cons in terms of, I already told you that it's 90,000, that times 4, it's quite a bit. She's not going to be nearly as much debt as I am, so something to consider. Also consider time, right? If just like has been said, if you want to start a family earlier, if you want to pursue other things, the MD route is a lot longer, and depending on what specialty you go into can be even longer. So I think that's something to consider as well. So I think when you're trying to choose between those two programs, definitely look at what long-term goals you may have and what you want to do at a certain time point in your life and what scope of practice you want to be in. I think that can really help you decide on which one you want to pick.
I will say though, when you're considering like MD versus PA, MD, you're going to go a little bit more in depth in your studies. So if you know you want to do surgery, you're going to study it longer, you're going to do your residency, maybe a fellowship in that, and you're going to be the one who's kind of leading the show, right? Where, if I'm not mistaken, PAs don't really have as much autonomy, there we go, autonomy when it comes to certain things. MDs are able to write prescriptions, sign off on their own notes, where that is, PA students are kind of, can you guys, oh, we can do that? Okay, ignore that last part. And I mean, either one is great. Again, you have to consider what your long-term goals are, like everyone is saying. I'm glad I chose MD because I'm really interested in women's health, and I think we have a really good program at OHSU for that. But like everyone's been saying, you just gotta think about it a little bit, talk to a few different people and get their perspectives on things.
And I'm gonna throw a third option in there real quick. Because, so a PA and a nurse practitioner are quite similar. The only thing is that so in order to be a nurse practitioner, you have to have a nursing degree first. But as a nurse practitioner, you can diagnose, you can prescribe. I worked in psych, so I did depression, anxiety, dementia. You have a lot of the same flexibility, so there is, third option.
So my question is for the PA students. How is it like to be in a PA program, and what are some of the challenges you guys face?
So, for at least our program, so first year is all didactic. So mostly all classroom time, little bit of mentoring where you see patients with your preceptor, but mostly you'll spend a lot of time in classroom building your foundational knowledge in science and learning about pathophysiology and just all different disease processes. So, if you imagine 8 to 5 sitting in classroom with lunch break in between, it can be taxing. I'm sure if you guys are still studying in undergrad, that's no news. But so that was probably a challenge, that prolonged period of just being in classroom. Second year, however, gets so much better, which I didn't trust when class above me told me it's so much better. But it really did, because you start seeing patients on your own and you learn so much that's not taught in textbook or in classroom setting. Your patients can teach you a lot just by talking to them or learning about what they have gone through in terms of their disease process or their life in general. So it really enriched my learning. I'd say I learned more in second year doing my clinical rotations. So we do rotations in primary care, surgery, general surgery. We also do electives. We also did orthopedic surgery as part of our requirements, and so much more. But in general, you're in different settings, rural or urban, as in Portland. And now I'm losing my train of thought. But in general, PA school, they say, it's fast and furious. It really is true. It's very tough. It's fast. You have to learn as much as you can first year and be out there seeing patients. Typically on your own, you always have your preceptor to go back to. However, the OHSU program does really well preparing us to be out there, and we are done in less than 2 months, so we're supposed to be practicing soon. And I feel that first year out will be a lot of learning, steep learning curve, but I do think that the program did well preparing us.
It's basically everything that Minji was talking about. You do get a lot of the hard sciences, and you learn about the disease processes in the first year. And the cool thing about the clinical rotations in the second year is that it really solidifies, that you really learn about diabetes when you're taking care of a patient with diabetes, and you learn, okay, these are the medications that I want to prescribe for him, and I want to up the dose on this medication, because you are doing it in real time. And I think in the first year, you're really forming a family among the 42 people who are in your class, because you basically need them to survive. And you have exams every Friday from all the material that you learn in that week. So it's back to back to back exams constantly. And they hold you at a high standard in terms of the passing score that you need to have for your exams. So I think it's a really rigorous but very fair course in terms of the way that they teach you. And the cool thing about second year is that, at least for me, I really grew into my own person, and I became more confident and more sure of myself. And it was personally challenging being away from everybody and having to do rotations on your own after being with all your classmates for all this time. But it's the biggest time for you to grow. So it's definitely an awesome and enriching experience to be in the PA program.
Personally, what was the most challenging obstacle that you've had to overcome?
I went through a divorce when I was in my master's program. He was domestically violent, and so I needed to leave for my own safety, but it was a difficult time, and I was contemplating whether or not I should stop school, but I kept passing my class. So I ended up relocating, lived with a mentor for a while, so mentors are very vital while I was getting myself together, but and went through some counseling and things like that, but was able to successfully pass and change my name and get a divorce all in the same month and graduate. So, I mean, I can laugh now. It's been almost 6 years. But, yeah, so that was probably my most.
Probably for me, kind of what they were saying about the PA program and the MD program, we also have weekly exams every Friday, which is tough at first, because at least in college, at the university I went to, in biochemistry, you would have an exam at the half of the, midterms, and you would have your final, and that was pretty much it. So it's kind of hard in medical school to get used to doing an exam every week, meaning you have to study pretty much all the time. So after a while, though, you start to get used to it, so I will say that. So don't let that deter you from wanting to go into a graduate program. You do get used to it, and it just becomes your new normal.
Yeah, I think for me the most challenging thing was maintaining an appropriate and healthy work-life balance. I think, at least for me in undergrad, it was a little easier to go ahead and keep that balance. But as Allyson said, having the weekly exams and the weekly requirements to perform can be a little daunting. And especially, you can always study more, right? You can always study another hour, you can always study another couple hours. But I think setting boundaries and being like, okay, I'm going to stop studying at this point so I can spend time with some family and I can spend time with some friends. I think working on that and maintaining a good, healthy balance is something that's really important. And I think it took me a while to get into that routine, but once I did, it was a lot easier.
It's been my experience that each program that I entered encouraged you to not work, and that I've never had that as an option because I support myself. So that has always been a challenge, being able to work full-time, sometimes more than full-time, sometimes less than full-time, and maintain school, and that can be really quite challenging. But I tell people, because especially in this day and age, it's just kind of not an option to not work at all. So I just want you to know it can be done. You just kind of have to figure out how to balance it.
Continuing on that note, balancing, as Kiki said, maybe balancing work and school, also balancing personal life and school. Sometimes you don't really have option to set some goals, on the side because of age. I've been trying to get pregnant and 43, so I know the clock is ticking, and I had to go through IVF and attend classes. And I remember one time after we did a transfer in IVF, and I was sitting for a final exam, epidemiology. So it was really hard. Another challenge, incident, I miscarried. And I think I miscarried over the weekend, and then Monday is the beginning of the spring term, and I had to go and attend class. So as Kalisha said, just keep going, regardless of what happened. Very important is to seek help and have support, and don't ever lose the sight on your goal, to get that degree, to finish that class, to get that grade, and try to use all the resources around you, and always, take care of your mental health. that's a very huge part, through this educational journey. Seek professional help. It's not really something bad. Doesn't say anything bad about you. It says you're human. And seeking help, professional help. Surround yourself with good people. Go to your chair or advisor, which is another point. I hope we can talk about choosing your chair, choosing your advisor later on. But seek the help of your advisor. I've been so lucky that my chair was very helpful, very supportive, and her background actually psychology. She's a nurse practitioner, psychology. So she kind of helped me to heal bit by bit and be very flexible with deadlines, but not to make me go slack on the thing I was supposed to produce and write and submit to her. But at the same time, she made me feel like I am here for you. We're gonna finish this journey. You're gonna finish your PhD. But at the same time, and she always write in her email or at the end of our meeting, she always say, "Take care of yourself." And this is my advice to all of you. Take care of yourself. Things will be done. This journey will be completed, and you will achieve your goal. But don't put yourself, or leave yourself under all these pressures and burdens without seeking help.
So, as an international student, language is the barrier. But at the beginning, I feel nervous before doing a presentations, or especially you have to communicate science in a different language. And I learned those languages in my native language, not in English. So that's the challenge. But after practice, so the most important thing is to practice, and then you have to make friends with people here, and then just step out your comfort zone. You cannot always find another international student and just keep not communicate with other people. So, and then through practice, I think I open up more and then talk more and trying to get involved the activity such as this panel. So I think I speak better now, and then I can communicate myself better, and then and I can be a better scientist.
I just need to add about this is very important, especially for international student whose English is not their first language. Seek resources, in campus. When I started in OHSU, there was no writing center in the School of Nursing or OHSU, other than the VILM, and VILM was a paid course. But we didn't have someone help you with editing and writing and things like that. But it's very good that PSU, they opened the writing center for OHSU students. So I used to bring my writing assignments and get help from people there. And then OHSU schools of nursing, we started our learning center, and they provide writing help to international students. Another thing, try to write a lot, and don't be embarrassed of what you're writing, and give it to other people, classmates. In the School of Nursing or PhD program, we have different benchmark, writing a grant, writing an integrative review or literature review. And all these, yes, technical skills, but the way of writing with clarity is very important. So we used to, give it to each other and, get feedback, read others and give your writing to others. That will really help, and seek resources.
For those of us who are looking to go into med school, I have two questions. One is, what can we do right now to prepare ourselves? And the second one is, if we're up in the air between two different specializations, how long do we have to decide which one to actually commit to?
Okay, for the second question, choosing a specialty, I think it's pretty much the norm to change your mind about 10 different times. So it's okay that as an undergraduate student, you're not sure yet. Technically, you have until like your end of your third year to decide, because at that time is when you're going to do your sub-internship. So that's basically where you're acting as the intern. So like you're a resident, and that's kind of like the letters of recommendation that you would use when you apply to residency. So kind of up until the end of that point is when you have to think about it. I've changed my mind in medical school 4 times, but I think I'm going to stick with women's health. And so it's okay. And we do preceptorship at OHSU, basically where once a week, each term, you are matched up with a physician, and so you go into clinic with them or you go into surgery with them. And so that's a good way to kind of test the waters and see what the different fields are, because you might go in thinking you want to be, a type of doctor and end up thinking, oh, maybe that's not for me, or one that you didn't consider might be the right one for you. So I definitely would take advantage of that opportunity if you go into medical school and just decide to go to OHSU, because that's what I did. I did 4 different specialties when I was in my preclinical years for that. And then, do you want to?
Yeah, just in terms of things that you can do, and I don't necessarily think this is exclusive to the MD program. I think this is probably for a lot of programs, but one thing I would encourage you to do is take anatomy. I think anatomy is very important. I did not take anatomy. OHSU didn't require it. Man, I paid for it, and I think a lot of the specialties up here, I think anatomy is a good thing to take. Oh, it's required, okay. So take anatomy, I think that's really good. And the other thing I think to do is, and this is something I did, is if you can, try to get in and do a little bit of research. I think that is something that I think is definitely, I think schools really favor that. Not necessarily it's going to be a deal breaker, but I think that's something important that schools really like to see. After I graduated, I actually spent 5 years in research before I did the MD program. I'm not saying to do that, not saying you have to, but I think it was a really good experience, and I think it allowed me to maybe stand out a little bit more. So any kind of research you can do, even if it's just 1 or 2 hours a week with a PI, I think just getting that baseline knowledge and foundation, and again, networking a little bit, right? I think that's really important, because your letters of recommendation are going to be really important. And if you go ahead, start in your junior year, maybe you start working in a lab a couple hours a week for a couple years, that PI might be able to write you a pretty good letter for you. So I think doing some research is something I would recommend.
Adding on to Esteban's answer, I think the important part would be, say if I'm saying in my application that I want to be a physician scientist and I've never done research, I think you want to put your application together to support the ultimate role that you want to play in medicine. So how do you want to contribute to medicine? So that could be through community health, through public health, through research. So whatever you want to convey in your personal statement to the application committee, you do want to show evidence that you have that experience, and why, and basically reflecting why do you want to do this. Since we have about 10 minutes left, so at this point I would like to ask all the panelists to maybe your last thoughts about how did you guys find your mentors? So your mentors and your advocates that brought you to today.
Okay, I reached out. There was a certain professor that we had. Her name is Dr. Amy Garcia, and after she was one of the block directors, I kind of really appreciated the way she had taught, and I had reached out to another student who said that she was a great person to know and that would be really helpful. So I essentially just not cold call, but I cold emailed, said, hey, I heard you're a really great person to know. Would love to get together and maybe talk about future goals. And she was more than willing to go ahead and meet with me, and that's kind of how I found one of my mentors. I think everybody here is probably going to say that if you reach out, I think a lot of people are more than willing to go ahead and help, because they've been there and they know what it's like, and so a lot of people are willing to give back.
For me, it took me a while to figure that out, actually. Because in college, I was very stubborn, and I did things my way, and I got through college. I managed to do that and get into medical school. But medical school is a completely different category to me than college. And so I realized kind of a little bit late that I needed someone that I could reach out to and I could talk to and ask questions. So recently I just emailed one of the professors in the women's health department, and she actually put me in contact with someone that she thought I would be a good fit for based on my interest in our backgrounds. Another good way to meet a mentor is to go, especially if you want a mentor who comes from a diverse background or a similar one to you, is to go to any kind of diversity event such as this. That's a good way to get connected with people because they are there because they want to help other students.
That's a great segue, thank you. Because most of my mentors when it comes to academics are not people of color. Actually, none of them are, actually. Yeah, 3 white women. But they have been great, and I found my mentors through school. Teachers I really liked or had interest in something I was interested in, and I reached out. Or they kind of took me under their wing. I don't know if you noticed, I'm quite talkative, so it's easier to talk with me, or for me to talk with them. But I have mentors in multiple areas of my life. I have mentors when it comes to my spiritual walk, and then I have mentors who I kind of value how they take care of their kids or how they do things in life. I'm a huge proponent and believer of getting everything I can get from people or sharing in their wealth and their knowledge and realizing that I just don't know it all and I'm okay with not knowing it all. So pretty much like everyone has said, reaching out to people, expressing your interest in needing a mentor, I think is all it really takes. People are really receptive to that.
Wafaa and I share a mentor, Dina, so I guess my advice would be A, be talkative, that's good, being friendly is good, and B, because I've been very lucky to have people take me under their wing, and then B would be if you are kind of attracted to a person, go with your gut. I know my mentor, Dina, I was attracted to her for different reasons. I was interested in the research methods she was using. And then when I started meeting with her, part of being a good mentor is to just be like, how are you doing? Like, how are you outside of school? And through those conversations, she just like blew my mind and helped me change my topic into such a more meaningful way. So yeah, just don't be shy, be friendly, be open, and seek out people.
For me, it was before landing with Dr. Dina Hasuna. I was with another chair, and at the beginning I was like, yay, I found, my match, but things didn't really go well. So at the beginning it was lots of frustration about communication, the personality sometimes clashes, and difficulty with availability. So one of the bylaws in the School of Nursing is that as a PhD student, you have the full right to hire or fire your chair or any of your committee member, and I practiced that right, and I was supported by the head of the program. So I switched to Dr. Dina Hasuna, and boom, everything was really going very progressively well. I finished writing my first 3 chapters of my dissertation. I passed my oral exam. I passed my defense proposal. And things went very well, and I felt very comfortable. So one advice to you is that you can choose your chair or advisor based on, if that advisor working in the same population of interest or the same disease of interest. Another one, as Kiki said, the methodology. If that person is really expert in the methodology, Dr. Dina Hasuna has nothing to do with critical care nursing, but in her methodology, she's really super. So I choose her based on the methodology. So don't limit your thinking or your options or choices based on one track. See how that person can help me to achieve my goal.
A good mentor I have is before I start PhD, I work in a lab. It's a startup lab, so the PI just set up a lab, and so she let me get involved in everything. Like how to like teach undergrads, to experiment. So I have these kind of teaching experience. And then she helped me with the application. So she like set up a mock interview with me, and then she also wrote me a letter for application, and then told me like which program she thinks is good to apply. So I think a good mentor can guide you to what you want. And then she's also a very cool PI. She's not like asking. She gave you freedom to set up your own schedule, and she's not ask you like, oh, you have to be here like 9 to 5 every day, and then she just give you freedom, and then she check with you like once a week. And then I think that's the really good. She's a very good mentor, and then let me decide. I want to continue to do a PhD. Yeah.
So one of the cool things about the OHSU PA program that really drew me to it was how I felt like the faculty was really supportive of its students, and I felt like they were going to go above and beyond to make sure that we got the best opportunities in terms of our learning experience. And what they do in our program is that they assign each of us to an individual faculty advisor. And so every semester, maybe once or twice, we'll come and touch bases with that person, and they'll come in and ask us how we're doing with the program, how we're doing, psychosocially and emotionally, if there's anything that we kind of need to work on or need to address. And so it's really cool knowing that you have someone out there who's watching out for you from the beginning, and they kind of follow you all throughout your journey in PA school. And they get to know you on a more personal level outside of just the classroom. And sometimes, more often than not, you might end up crying in their office for some reason, or another, or talking to them about financial problems or family problems. And so it's good that they allot you this one person that can work for you. Sometimes they don't click and sometimes they do, but just like everyone said, reaching out to people you feel really strongly that you can connect to them, and being open and upfront that you want to establish that connection is the best way you can go about it.
I'll just try to keep it short, but in Hawaii we don't have much PA workforce, so I just emailed the entire state society, the president. I just went up there and be like, hey, I'm really interested in shadowing a PA, having really tough time, can you connect me to someone? And she just forwarded my email to everyone. So, and I got connected to a PA, and then he became my mentor. He guided me through getting into PA school, did tons of mock interviews. He criticized me until I came to perfection. So, I think that's a little different in Sorry, what? It's a little different in Oregon, but you can just reach out to even the Oregon Society of PAs if you are having a tough time looking for PAs to shadow.
Okay, and with that, we'd like to thank all of our panelists for all of their time. Thank you to all of you for coming. Thank you to Dr. Morris for helping me put this together. And we're all around to answer any last-minute individual questions. But apart from that, happy weekend.
Yeah, let's do that. Close us out really quick. Can we just give them another round of applause? That